Hello again. Welcome to part 2 of your exam review video. This presentation discusses chapter 14, your methods of psychotherapy. Now, remember we talked about how do you describe psychotherapy and what psychotherapy is. According to the American Psychiatric Association, psychotherapy describes the use of psychological methods and is defined by the interaction or the treatment between a trained professional and a client, a patient, couple, or a group. And the goal is to help a person change and overcome problems. The problems are psychological in nature, and they can vary in terms of causes, influences, and other types of resolutions. So we'll talk about many of these in just a few minutes. What are the goals of psychotherapy? Well, the major goals of psychotherapy are to explore thoughts, feelings, and behaviors. And these thoughts, feelings, and behaviors are the ones that have been created by conflicts or difficulties in your lives that you can no longer handle. Help one become proficient in solving their own problems. Increase in individuals' sense of their own well-being. Reduce the negative symptoms and emotional or mental health problems that exist in the individual. Now, there are various types of psychotherapy that we discuss in this unit. And we talked about psychodynamic therapy, and it goes all the way back to Sigmund Freud and his psychoanalytic approach to therapy. The primary focus is to reveal the unconscious content of a client's psyche in an effort to alleviate the psychic tension. And of course, we know that it was developed by Sigmund Freud, who formed talk therapy designed to help clients gain insight into their unconscious conflicts and is believed to be at the root of their psychological problems. That he believed that these conflicts arise, of course, in the childhood. Now, there's another type of psychotherapy that we talked about. We talked about client-centered therapy or person-centered therapy. And this is therapy that was developed by Carl Rogers. And the focus of client-centered therapy is to help a person act in a way that is consistent with their own self-concept. And he uses more of a non-directive approach to emphasize 3 treatment components. Carl Rogers says that there are 3 conditions that must be present. Must demonstrate unconditional positive regard. And this is where the therapist accepts the worthiness of the person. He does not judge the individual. Genuineness, being authentic or true to oneself, being real with the client, not pretending. And empathy, which the therapist understands the person's feelings and their subjective experiences that they are going through, that they can be in the moment with the client. So make sure you know the difference in unconditional, genuineness, and empathy. We talked about behavior therapy, which utilizes principles of learning to help people change maladaptive behaviors and develop healthier behaviors. And a lot of these therapies, we talked about the learning therapies, the therapies that people change their behaviors. Cognitive therapy, founded by Aaron Beck, where people understand how all of these faulty thought processes influence how they perceive the world and the reactions, where they have all these negative thoughts about themselves. And it's also systematic desensitization It's a form of exposure therapy that helps people overcome fears by applying relaxation techniques as they imagine approaches their fear triggers. Everyone has a phobia. So there are three ways that this works. Step one, there's an anxiety hierarchy. First, they build our anxiety hierarchy, which is a list of those situations of fears that lead to the largest situation in order from the least disturbing to the most disturbing situation. Then step two, they go into relaxation training, deep muscle relaxation. And then there's the desensitization sessions where they work through this hierarchy to eliminate the fear. For example, fear of snakes. First, maybe by looking at a picture, thinking about it, drawing a picture, watching a movie about snakes on television, going to the zoo, and then finally being able to be in the presence of the snake. This is systematic desensitization. Then you have eclectic therapy, in which psychologists and therapists use more than one therapeutic approach. They integrate techniques from many different orientations. So they go back and pull from the psychoanalytic, the behavioral, the cognitive, the biological, the learning aspects to help individuals with their situations, because there's no one method that solves anybody's problem. Then you have group, family, and couples therapy. Group therapy includes you have a therapist and you have more than one client, and they're treated together in a group format. And in this type of therapy, our clients discuss similar situations that they may be experiencing. Drawbacks to this type of therapy is there are trust issues because they are sharing confidential information with strangers, and they're less likely to want to become a part of a group therapy. Family therapy focuses on improving communications among family members. Many times when there are family conflicts, issues that the family themselves cannot resolve, they will often go into family therapy, and the therapist allows each family member in the group to discuss whatever issue may be causing the conflict in the family. Then there's couples therapy, where that helps promote better communication and problem solving between people in close relationships. Many times there are couples who want to get married and they're experiencing issues. Maybe couples are already married and they're experiencing relationship problems, but just need some help in learning how to communicate and solve those issues. Now, we talked about biomedical therapies and drug therapies, and on your exam, you wouldn't have to really just identify groups of therapies, maybe particular drugs that we talked about on the exam. So biomedical or drug therapies are used to treat psychological disorders, and they are classified within major categories. One such group we talked about are your anxiety drugs, which treats anxiety-related disorders such as your social anxieties, your generalized anxiety disorders, any anxiety-related problems such as PTSD. And one type of drug we talked about was Xanax. Valium is another drug that is often used. These are in a class called phenothiazines. Your antidepressant drugs treat mood disorders, such as your SSRIs, which stands for selective serotonin selective reuptake inhibitors, which controls the serotonin in the brain that causes the depression or the mood swing within the brain. Prozac is one we talked about, as well as Zoloft. Your Ritalin and Concerta are stimulants used to treat hyperactive disorders in children. These drugs help slow down their children's hyperactivity in the brain, and where they can be in a calmer state in which to function. You have your antipsychotic drugs, which you use to treat the positive symptoms of schizophrenia and related conditions. Thirazine, your chlorpromazines, your lithium carbonates, those types of drugs. Make sure you go back and review these classes of disorders so that you can understand how these drugs are related. Review the handouts that I gave you on the various drug therapies and those psychological therapies. Then your lithium stabilizes moods in patients who have bipolar disorders, which are your manic depressive states. They calm them down in a manic state, and when they are in that depressive state, it helps elevate those moods in those individuals. And also within your the counseling, therapeutic situations, you have to make sure that the therapists are very aware of multicultural issues when it comes to treating other races and ethnicities. And they have to be sensitive to how they work with those clients in a therapeutic environment. There are racial issues. There are issues in race, certainly. African Americans are the least likely to go to therapy. Native Americans will not go to therapy. Mostly your Asians, they will not go to therapy as well. Ethnics, language barriers. If you cannot speak the language, you will have issues. Most of the time, if there is a language barrier, then that client needs to be referred to someone who speaks their language. Cultural backgrounds. What beliefs? In a lot of the countries, they don't believe in going to therapy, such as your Asian and your Hispanics. Not very trusting of therapists. Most people don't like to go to therapy because they have trust issues. And in some of the Asian countries, it is looked at as telling the family secret if you go to therapy and say what's happening with you. And of course, like we said, they often do not seek therapy or counseling. So in your handouts, make sure that you can identify several drugs. Make sure you understand the different methods of therapy. And of course, we talked about how effective therapy is. People who are in therapy, the most effective therapy is cognitive behavior therapies along with your psychotropic medications. And make sure you understand the major types and uses of these psychotropic drugs. Go back to your handout and look at the overviews of these different classes of drugs. Good luck on your exam, and we look to see you do well, and I know that you will do well on your exam.